Mercy Southeast serves over 625,000 people in southeastern Missouri, with over 200 physicians and 48 locations. It is ranked in the top 5% of the nation's hospitals for patient satisfaction by the Centers for Medicare and Medicaid Services.
So we've been offering our outreach lab services for about 15 years, and I've been involved with it for the past 5 years or so. And we really see that locally, we are the preferred lab, even above Quest and LabCorp. So keeping that in mind, we started to grow over the past few years, pushing our boundaries, offering services to other states, west of the state that's outside of our primary region. And we've been successful at that. And I think it's because of our customer service and our technology that we have. At Mercy Southeast, we have 8 laboratories in our system, and the flagship hospital is located in Cape Girardeau. We run about 3 million tests per year at this point. We have about 120 lab employees.
In 2023, Mercy Southeast completed construction on a new reference lab to support the increasing needs of the communities it serves.
Our growth strategy is, one of them was actually getting this equipment, this Abbott equipment in our lab. We just had a couple of analyzers and they're at max capacity. So adding more analyzers and the fact that they're standardized across our region allows us to handle that volume that comes in. Another piece that is important is, that inventory and controlling your cost and making it efficient and affordable on the operations side.
Managing inventory for 8 labs manually was challenging, especially as the volume of lab tests increased. To address these challenges, Mercy Southeast selected Abbott's AlinIQ Inventory Management System, or IMS, to help optimize the diagnostic workflow with multi-site capability, streamlined ordering, simple consumption tracking, transparent inventory status, better compliance, quick check-in.
Prior to IMS, we had quite a few challenges with reagents expiring on our shelves. We had our technologists selecting the wrong lot numbers of reagents and putting non-active lots on the instruments, which caused additional calibrations. And we also ran into some issues of running out of stocks that are critical to patient care. We ran out of troponin one time here at the hospital going into a weekend, so we had to get creative in our solution there, and we had to outsource from other neighboring hospitals. The most valuable feature to me was to have a real-time representation of our inventory. With IMS, you are able to pull up the inventory on a computer and see in real time what those inventory levels are for every individual reagent. This gives you the dollar amount. It also shows you what's expiring soon, and it shows you where you can take action to make sure you don't run into those issues. Our plans to expand the use of IMS extend to third-party reagents such as our molecular supplies. They're very high dollar, and we want to ensure we track those throughout the lab.
While Abbott's products come pre-tagged, IMS can print RFID tags and track third-party reagents.
So one benefit we have seen has been huge is in the labor and time it takes to do inventory. The way we were doing it in the past was all manual. We had worked up spreadsheets and had set par levels on those, but once a week the multiple sections would have to go around and do manual counts of all the inventory, and then if it hit the par level, then we would place an order. Our inventory is so large that it was split among several people, several different departments, and there was just inconsistency in the ordering and the counting. So what used to take that one person, times several sections, about 4 hours a week, is now taking about 15 minutes per person. We've seen, of course, that labor reduction, and it's more accurate because the part levels are built in per each item number, and IMS gives us suggestions on the quantity and the items that we need to order.
RFID technology allows a technologist to quickly complete a physical count of the inventory without inspecting every item.
Prior to IMS, our chemistry inventory was about $515,000 at the end of 2021, And then after we implemented IMS in 2022, our chemistry inventory was reduced down to around $400,000, which was about a 20% reduction in inventory, which freed up a lot of additional capital to devote toward other projects.
We've had a great partnership with Abbott. Starting in 2020, when the pandemic was here, Abbott really supported us to get our testing in place, getting us equipment and all of that, and our partnership has just become stronger. One of the things that we love is that Abbott is flexible. They listen to our feedback, and if we need to think outside the box to get around a solution or around an issue or even plan together for future, we can tap into Abbott's resources, and I'm confident that we will continue to grow and be in the forefront.